When the companion cold compression therapy kit arrives at your hospital, what are you going to find in the box? First, we're going to have the large stifle wrap with its gel insert. There's a medium stifle wrap with its gel insert, and then an additional gel insert for both the medium and the large wraps. The pump with its multiple port adapters, and the AC unit for charging the pump in preparation for use. We do recommend that the pump be charged prior to use. The pump will hold a charge for 4 to 6 hours before needing to be recharged. If your pump is not charged but you need to treat a patient, you can plug it in right next to the first port and use it while plugged in to treat a patient. For cold compression, the gel insert should be in the freezer at least 1 hour prior to patient use. 5 minutes before using it for a patient, take it out of the freezer and allow it to rest to increase its flexibility and conformity to the patient's limb. After taking the gel insert out of the freezer and allowing it to rest, place it into the appropriate size stifle wrap and Velcro it in the 3 places. Once the wrap is in place on the area to be treated, simply clip all of the clips in place to secure it into position on the patient. With all of the clips placed, then these straps can be adjusted accordingly to not over-tighten on the patient so that they remain comfortable during the entire treatment. A lumbar strap is provided for those patients that need it, or it can be removed if necessary. With the wrap securely in place, take the rubber hose coming from the wrap, find the plastic end, and plug it into the pump at one of the 3 ports, labeled port 1, port 2, or port 3, until it clicks into place. For patients that do require multiple treatments, there are multiple ports to achieve treatment at one time. With the wrap now attached to the pump via the hose, simply turn on the pump by pressing the on-off button until the lights are illuminated. Using the port the wrap is plugged into, select the pressure by using the set pressure button to find the appropriate pressure for each individual patient. Options are 30, 40, 50, 60, and 70 millimeters of mercury. The higher the amount of pressure, the more compression will be provided to the patient. Adjust according to individual patient needs and size. Once the pressure is selected, the treatment session will begin on its own, gradually inflating the wrap with air and then deflating it for a short rest period. This provides intermittent compression while constantly icing the treatment area. During the pump inflating, the corresponding light for the port will flash, indicating that the treatment is active. Adjusting the pressure at the port can be done during a treatment session by changing the pressure during the deflation period while the pump is at rest. After 20 minutes, the treatment session for that particular port will automatically time out. The port will beep and the indicator light will flash for 1.5 seconds while the display flashes the letters TO. If you are treating multiple areas or patients, each port will automatically cycle through and time out on its own. When the last port is finished, the alarm will sound for 15 seconds, at which point the entire pump will shut off. After the patient treatment session has ended, turn off the entire system by holding the on-off button for 1 to 2 seconds. Unbuckle the wrap and remove it from the patient. To remove the rubber hose from the pump, press and hold the metal tab and pull on the plastic end to remove it. Remove the gel from the wrap and wipe down both the gel and the wrap with a 3% hydrogen peroxide solution. Do not use an autoclave or any other cleaning solutions other than 3% hydrogen peroxide. Once the gel is cleaned, return it to the freezer so that it is ready for the next patient use. After cleaning both the gel and the wrap, plug in the pump to charge if needed. If you want to use the system for heat therapy, you can place a room temperature gel insert in the microwave for an initial 30 seconds and then microwave the gel insert in 10-second increments, but no longer than 2 minutes total, until the desired temperature is reached. Make sure to test the comfort of the insert on your own skin prior to placing on a patient. Once the ideal temperature of the gel insert has been reached, follow the previous instructions for usage from earlier in the video. If you want to use the system for compression therapy only, do not attach the gel insert inside the wrap. Buckle the wrap minus the gel insert around the area being treated and adjust the straps accordingly to hold the wrap in place. Do not over-tighten the wrap as you want the patient to be comfortable during the entire session. Once the wrap is in place, follow the previous instructions for usage from earlier in this video. If you want to use the system for icing only, do not plug the wrap into a port on the pump. Attach a previously frozen gel insert inside the wrap and buckle the wrap around the limb being treated. Adjust the straps accordingly to hold the wrap in place, but do not over-tighten the wrap as you want the patient to be comfortable during the entire session. Once the wrap is in place, set a timer for 20 minutes. After the 20 minutes is up, unbuckle the wrap and remove it from the area. Remove the gel from the wrap and wipe down each side of both the gel insert and the wrap using a soft cloth and only a 3% hydrogen peroxide solution. Then return the gel insert to the freezer for future use.